Finch?
Here.
Dr. Hussein? I see he just joined. Okay. Mr. Larson?
Here.
Dr. Munir? Yep, she's there. Dr. Skelton? Dr. Skelton? No. Okay. Mr. Spadoni?
Here.
Mr. Thurston? Okay. President Tornatori?
Here.
Dr. Weeks?
Here.
And Dr. Wilson?
Here.
Mr. President, you do have a quorum.
Hey, Penny,
you.
I'm here too.
Who was
Dr.
that?
Nadeem Hussein.
Okay, hi. Thank you.
Well, welcome everyone. Do we have any public comment, Penny?
No public comment came in.
Okay, there being no public comment, I have a few remarks. It's great to see everybody again.
Can I just make sure that we're streaming, Luke? Do you have us
Oh,
streaming?
sure. I'm sorry.
Sorry. Okay,
Okay.
thank you.
Sorry, Luke.
It's all right.
Welcome to board members and to our leadership team. Certainly during the course of the evening, we're going to be hearing about what we've done with COVID and public health since we last met. We're also going to be addressing other public health responses, approving expenses for the flooding event that occurred last month, as well as other threats to public health, such as the West Nile virus, which is another virus that we have to deal with now as if we don't have enough. Certainly, this has been anything but a typical year. The state of Illinois has passed the budget for the fiscal year 2021, or does have a budget, and brings a significant number of grants for us. And with the help specifically to us with because of our lobbyist Chip Humes and Representative Deb Conroy in Villa Park, we appear to be in line for a $5 million allocation from the state to support the Central Receiving Center, which we had talked about maybe about a year ago, which we talked about it earlier was maybe a pipe dream at that point. And to get that would be phenomenal for us to be able to work with not only the state with that amount of money, potentially the county has money out of COVID funds, which would also be used to support this and bring something which is sorely needed to the county for those people who have nowhere to go after they have certain drug problems and find themselves leaving an emergency center or in lieu of an emergency department coming to this receiving center. So there was a memo in your packet, which hopefully you all read. We'll be discussing some more plans with this in executive session as well this evening. We will not be meeting in July. But staff's going to begin the budget presentation and will provide us with a budget calendar at the August meeting. Couple of two more things. You may be aware, and I don't know if we talked about it last week. There was a place in Wheaton called the Brick House. It is a fitness center for weightlifters, etc., that pretty much ignored our directives to not only have no more than a few people, but they were open for business and would have 25 or 30 people in there. We asked them 2 or 3 times if they'd stop doing that. They didn't. We issued an order that was ultimately through the health departments served upon them to cease and desist. They essentially ignored that. Ultimately, we had to file a lawsuit in court. There was a court hearing this morning. Judge Fullerton asked us to amend our petition given the fact that we're now in a different phase. However, the Brick House owner has hired a lawyer, so he is taking it seriously. He was quoted in the newspaper as saying that he just thought that his fitness center was an essential business and he was pretty much going to ignore the governor's orders. So I think he essentially admitted to a wrongdoing in the newspaper. So that may be one of the first pieces of evidence, at least that you're going to admit. But in any event, that's one thing. A really good thing to point out is the 501c3, which is up and running, has $10,800 in change in it, which has been generated through contributions over the Giving DuPage and a $5,000 grant that we talked about last time that was a match. So we are in really great shape starting out. I think we're, you know, it was our first fundraising effort, very successful. And Dennis, thank you so much for all you've done to make that happen. With that, I will turn it over to Karen for tonight's report.
Great, great. And Luke, if you could pull up the presentation for us. Absolutely. Great. So we wanted to do a presentation tonight again on COVID. But if you go to the next slide, we wanted to make it both kind of a retrospective. So we want to look at where we're at with current numbers and statistics. We also now are in day 142 of our response. And I just can't go any further without commenting and thanking Luke for joining us. He's actually on vacation, and I was very surprised to hear his voice on this web platform this evening. He's on vacation, but is pitching in because his team has been pulled in so many directions. And so again, it's another symbol and another piece of evidence of what an amazing team you all have at the DuPage County Health Department. So we're going to talk about what we've been doing a little bit, and then we want to look ahead to the next phase of our opening as an organization, and as well as some of the ongoing activities that we'll have. So next slide. One of the things that, you know, if there is downtime when you're in a COVID response, you feel awkward because it's like, I'm not going every minute of every day. And that certainly is something that none of us is used to. So our amazing health promotions team took an opportunity with some of their staff over the last month to really update our website page dedicated to COVID. And if we're able to click on that link, I just want you to see what an amazing job they did, because it started like every website to just be throwing information up there, and there wasn't a lot of organization. It's very challenging to find information. And so what they've done is pretty amazing. So now all of the information is categorized under these tabs. And so people can find information. And of course, there's information that's consistent, that's in business and employers. It's also in community. That may also be in schools and daycares. But again, it's an opportunity to organize and fashion all of this information, I think in a very not only attractive but an effective way. And then below that, we see the counts. And then when you go to the next link, which Dr. Chug will be talking through, you will see the data that we continue to compile on a daily, weekly basis. And Dr. Chug's going to talk us through some of the information that is, I don't know that it's harder to find, but it's really very relevant, and we want to make sure that you all know how to get there. So with that, Dr. Chug.
Yes, thank you, Karen. Good evening, everybody. And yes, thank you, Luke. If we could scroll down, we'll start. So here we have all the, the maps certainly centrally, and then our cases on the left and the deaths on the right, and then scrolling down slightly further, the municipality breakdown in the center. But if we could please go to the bottom left graph, if we could open that up, please. There you go. And we'll go through each tab briefly. So as Karen mentioned, the primary metrics that we're tracking are the cumulative number of new cases over time. So you'll see here we had quite a rise, and we really, I think, collectively felt this as a community, and certainly at the health department, all of us, including our board, of course, and a pretty steep rise through April and May. And then we are finally, and hopefully sustained, seeing a little bit of a plateau there. So Luke, if we could please go to the next tab at the bottom that shows the number of new cases per day. You'll see the bars show the number of new cases over time, and then the blue line is our 7-day rolling average, just to kind of smooth out the fluctuations day to day. And you'll see that even if we account for a little bit of reporting lag, that we're appreciating a significant downward trend, which is encouraging. So we realize that that we've reopened in recent weeks, May 29th it was, and we've also had significant civil unrest, and just it's summer, more people are out and about and interacting, and hopefully continuing to do so safely, social distancing, using wearing a face covering, and practicing good hand hygiene and other infection prevention measures. So we do hope to continue to see this downward trend. I will say, as I think we all recall, we were averaging triple-digit new cases every day, between 100 and 150, and in for the past several days, it's been more double-digit. So that's a fortunate thing. And then one of the other metrics that is being followed is the number of positive lab tests per day. So here we have our bar graph that shows the dark blue bars at the bottom show your positive number of tests over time. So, and then that's stacked with the, or vertically stacked with the negatives, and then the unsatisfactory, which are relatively few, but nonetheless, you can see overall testing capacity increasing over time with an overall rise in the graph, and then the positivity, the dark blue at the bottom, overall declining with a little bit of fluctuation there. And then if we could go to the final tab here, so these are counts, and the final one here is the positivity, or the percent positive of total lab tests done per day. So again, an impressive decrease here, where we, consistent with the state, are at just shy of 5% currently. And yeah, so that's, I mean, we certainly had been, as you can see, sometimes even exceeding 30%. I mean, early on, even exceeding 35%. So, so fortunately, we are finally experiencing a decrease in our positivity as well as our overall activity currently. But as I mentioned, we have been, we're closely monitoring this given the recent opening up of, or reopening, gradual reopening of the community, and increasing interaction between people from different households and in work settings, and even public demonstrations and all. So that's overall activity tracked by new cases. And now if we could go back to the dashboard, Luke, and then go to the bottom right graph to look at severity outcomes. So perfect. We could open that up, please. And so here we have, starting with our cumulative deaths over time. And we are fortunately starting to see a little bit of leveling off and plateauing of this curve as well. And then if we go to the next tab, you'll see our number of deaths per day. And again, the bars show the specific number of deaths per day, and then the blue line is the 7-day rolling average. over time to smooth out the fluctuation a little bit. And there is probably the most reporting, or the longest reporting lag in deaths, just given the time from when it occurs to when it's reported. It can be within a day sometimes, but typically it's, I'd say on average, 7 to 10 days, you know, depending on the location and the circumstances involved, and, you know, if it was in the hospital or at home, and how that's communicated. But even if we do account for that lag, and go back to, you know, even the third week of May, which would be over 2 weeks from today, there's still an appreciable decrease from what appears to be a peak or an apex in around the second or third week of April. So then the next, the other metric that we're following is our hospitalizations over time. And here too, fortunately, we're seeing a little bit of a leveling off with our cumulative hospitalizations by admission date. And then if we could please go to the final tab of hospitalizations per day, fortunately, we are seeing a decrease here. So so again, there's a bit of a reporting lag, easily about a week or so. Sometimes the reports of hospitalizations, whether it's, you know, the hospital not entering the data right away, or just having incomplete data until they're discharged, or for a variety of reasons. But again, even if we go back 1 to 2 weeks, there's still a significant decrease from our highest activity, which was in probably the second week of April. So with that, I'll just mention briefly, as we're hearing, there are other states that are seeing significantly increased activity, Arizona, Florida, Texas, and there's a variation, I think, in what some of them are experiencing, not only overall increased cases, but also, you know, increase or, you know, surge capacity. Their healthcare capacity is being taxed significantly, which is concerning, like in Arizona and Alabama and different states. But there are other states where they, what I understand, for example, in Florida, there are an increasing number of cases, but their hospitalizations are not necessarily increasing yet. But at least, fortunately for now, we are seeing a downward trend across the board, whether it's new cases and lab positivity, along with the more severe outcomes of hospitalizations and deaths. And again, we continue to monitor this closely as far as when we expect to see an increase related to reopening and or, you know, public demonstrations and other interactions. It would have been, as far as new cases, it would have been as early as June 2nd onward. And then for hospitalizations and deaths, it would have been around June 10th and then June 14th onward. So we're kind of in that realm where we could potentially start seeing some increased severity in our hospitalizations and deaths. So we'll continue to monitor, but thankfully we're seeing an overall improving trend here. With that, I'll pause and turn it back over to Karen. Thank you. Thanks, Luke.
So the response objectives, we actually, on the next slide, you'll see starting, we have, I think we're up to 9 response objectives for our response plan. That again, we meet on daily as a leadership group. I'm not going to go through all 9 of them, even though Bob Larson really wanted me to. I'm just going to highlight some of the more active elements. So the first objective we have is realizing that the identification of new cases and then further identification of potential contacts is one of the key strategies that we have in really holding down the spread of virus. We have expanded our internal capacity, and really I think we're at as far as we can go. We have 70 staff who have been really 64 staff who have been added to the original 6 staff responsible for case investigation and contact tracing. We were recently able to apply for a grant through the Illinois Department of Public Health for approximately $4.9 million. We will use that to expand our pool of staff by about 110 to assist us going forward. We will be using temp staff, and we have engaged the assistance or proposed to engage the assistance of a temp agency to help us navigate, because clearly that represents many more staff than what our 5-member HR team could manage. In addition to that, though, we have also worked in coordination with Lisa Shavak at WorkNet DuPage. She wanted to support our efforts through an application the Department of Labor had available. And so through that grant, we may be adding even more staff. Certainly when we looked at the ratios that were being recommended by CDC, the recommended number of individuals that we would have based upon our community size was closer to 300. So that 110 staff, 150 staff represents about 50% of that. And we're hopeful that we'll be able to add an additional 20 staff through the Department of Labor grant. Finally, you probably remember early on we had applied for CDC Foundation Funding, and we actually have they have hired on our behalf 2 excellent epidemiologists who will be working with us for 6 months. Originally, that the agreement was for 12 months, and then we were notified that for reasons beyond their control and our understanding, the term has been reduced to 6 months. So again, those are individuals who Rashmi and her team were able to interview and interact with, but they are being hired through the CDC Foundation. And finally, some of our efforts going forward are really around developing messaging to provide information on what case investigation and contact tracing is, because clearly we're very unsettled societally, and people are extremely nervous about members of the government calling them and asking them potentially intrusive questions and so what we want them to better understand is why we're doing that. The second objective that I wanted to highlight today was the amount of personal protective equipment that we've been collecting and then distributing. We have distributed over 11,000, which seems very low. And I'm thinking I might have grabbed the daily number instead of the overall number for this slide. But that includes all of those items listed. So gloves, face shields, aprons, and you can read the rest. Up until this last week, we were hearing from our healthcare providers as well as our long-term care facility partners that they were still in conservation mode with their PPE supplies. And certainly our supplies have been helpful, but not nearly enough to get them back to the status that they are using PPE in the manner in which it was intended to use. However, the pipeline does seem to be improving slightly. And certainly we are looking at and building plans for the next wave of preparation. You'll remember that one of the reasons why Chicago didn't have any PPE needs was because they had been stockpiling for years. And that left them in a much better spot to respond to this. So we intend to work with the county and do that as well. Next slide, please. Another opportunity or response objective that we've been engaged in is alternative housing. You remember that at the beginning of this response, there was a state-operated site in Schaumburg. They had contracted with several large hotels up in Schaumburg to house individuals who didn't have a place to isolate themselves. That site, all of those state-run sites closed as of June 1st. You'll also recall that the County of DuPage has supported OSOM originally, Office of Homeland Security and Emergency Management, developed and most recently it was a health department run site at Wheaton College, also closed earlier this month. So we find these resources closing at the time when the need for isolation is just now being understood in the community, and particularly understood in underserved and low income populations, as well as high need populations. So it is an element of the response that we uniquely are responsible for. And so we have entered into a lease with Ray Graham Association for one of their cottages that's emptied at the Addison location for isolation and quarantine. I put on here that it's operational, and that's probably a little bit of a stretch, but you'll see from the photos that the cottage on the left is where there's actually room for five or six, Andrea, individuals to have a bedroom and a bathroom to themselves, and then a small living area as well. And I think we'll be fully open, fully ready to take people into that site early part of next week. That's required a great deal of attention and work by Andrea and some of her leadership who have been responsible for that. And so we're extraordinarily grateful for their efforts. And then next slide, you'll see that we have we had our opening, our VIP walkthrough, and we had our soft opening today. I'm encouraged to see that Chris is still on his feet because he's been out there for very long days, the last couple of days. We are opening the first community-based site for testing in DuPage County. It's also the first community-operated and state-supported site. The state is providing us with testing materials and lab capacity to run those tests. They also provided us with several weeks of very intensive and very helpful training from the National Guard, who had set up and operated all of the other sites in the state of Illinois. When we're fully operational, we'll be able to provide 2,000 tests a week, roughly 400 a day. And we will be opening this site that officially on Tuesday. Today and tomorrow are kind of our soft opening days, where we've tried to allow the test staff to learn their roles, become familiar with them, and actually practice them. So today was the first day of that. I would like to highlight that this is really a partnership between county leadership, the County Department of Transportation, facilities, DuPage County Fairgrounds, as well as, again, Office of Homeland Security Management. We will be open Tuesdays through Saturdays from 7 a.m. to 3 p.m. And the staffing and operational costs of this site are significant. However, they are being covered by the County COVID CARES Act funds. We estimate that for a 12-week testing site to be operational that will total about $2 million. So next slide. I wanted to just put on people's radar because although we kind of roll our eyes with the Operation Warp Speed moniker, we do know that we as a country and kind of as a global community are really pushing toward the development of vaccine. And so we have been also dedicating some of our time, and we'll be really establishing a team beginning in July to take a look at vaccination distribution. So we're exploring and researching different models, identifying potential partners, asking staff who are helping us with some of these other activities if they'd be interested in helping us with this vaccination effort, as well as pulling out the playbook from H1N1 lessons learned and beginning to explore what might be some opportunities. So that has to do with our response plan, but we also are a provider of services. So next step, slide and step. Lori and Adam have been heading up, primarily Lori, a team to really look at how are we going to phase our staff back in. So next slide. We realize that for the past 12 weeks, our typical client services have been scaled back. In-person appointments have been canceled with very few exceptions. Many of our services we were able to quickly transition to telehealth or curbside as applicable, but there are some things like a long-acting psychotropic medication injection that can't be managed by telehealth. And so those are some of the things that we've been doing in person. Telework was also implemented for office-based workers, and we have maintained a philosophy of safety for our employees so that only minimum essential operations continue during our emergency response. We've been able to modify our building hours. Typically, we're open from 8 in the morning till 8 in the evening, and we've pulled back on those as well. Next slide. So now we're looking at bringing staff back. And again, this is a challenge for businesses who aren't engaged in also this ongoing response. But I would like to highlight the work that has been going on with the leadership team on a daily basis, because we have to be standing up and making decisions on what client services are going to be resuming, while we're also have some of our staff deployed in these other areas. So we still have staff deployed over in doing case investigation and contact tracing. We still have, we now have more staff who are helping with the testing site. And so it's this very dynamic tension of how we're going to get more of our services back up and operational, keeping our staff safe, keeping our clients safe, and maintaining our public health response. So Lori has been masterful in developing a plan that really focuses on opening up some of the clinical programming that provides essential services to clients. Beginning Monday, June 15th, and we've been communicating with staff for the last month and intensively for this past week on who will be coming back so that they can make the necessary provisions for their work-life commitments. Our services will only be available by appointment. There will only be one individual, whether that be a parent, a guardian, or a family member, who can accompany any client when they come in. We will still be offering our 8 to 4:30, our more limited business hours. And importantly, telework will continue for a significant number of our staff. The front doors at our facilities will remain locked. However, we've installed doorbells, and clients will ring the bell for service so that we can, again, keep a bit of control over who is coming in and leaving our sites. Next slide, please. We have really modeled our reopening based on safety first. So we have and will continue to have masking requirements for all staff and clients. Again, we have a variety of staff positions, at risk levels, if you will. So we are making sure that we have adequate supplies of the PPE necessary. We'll be having health screenings for staff and clients. Our facilities team have been rearranging waiting rooms and the break rooms and other places to make sure that 6-foot distances are adhered to. We'll also have increased disinfecting around the strategy of infection control. Our staff, our environmental health staff, as well as some of our community-based behavioral health and family health staff are going to begin going back into the community. And so we're making sure that they also are equipped with PPE, hand sanitizers, and flexibility in where they can meet with their clientele. Looking at, certainly with the nice weather, being outside versus in an apartment or an enclosed room. And finally, we're sharing this information with our external partners. Next slide, please. One of the ways we're doing it, again, is we're leveraging our amazingly talented health promotions team. And they have been developing this signage that you will see is going to be placed up at all of our locations. Next slide, please. In different areas to accommodate the different safety messages. We also, next slide, please, you'll see we'll have these, and they're the peel off kind. So at the entrances at our buildings. Next slide, please. And then we offered this because we thought they were very attractive and ways of reminding people. We offered this same branded campaign to the county, and we will be providing them with the messaging that's branded with their colors and logo as well. Next slide. So that's a little bit of what we've been up to this last month, and I'd be happy to take any questions.
Any questions of Karen?
This is
Or
Lori
Rashmi.
Bottoms. I have a question regarding antibody testing. Is there any plans to do more county-wide or targeted antibody testing to understand the level of spread in the overall county?
Rashmi, I'd like to punt that one to you, please.
Sure. So not that I'm aware of at this time. And I think the potential benefit of it is kind of what you described, to have more surveillance level, population level prevalence and, monitoring of activity. At this time, there's no recommendation for individual level testing, or at least evident, there's no specific understanding of how the presence of antibodies would be interpreted. That doesn't necessarily mean that the presence of antibodies confers immunity or protection, and if so, for how long. And so right now, I guess there's a lot of research and analysis in place about that, and we know several health systems have begun antibody testing, and some for monitoring purposes, but I think maybe some are using it individually just to have some sense of who's been exposed and who hasn't. But I'm not seeing any recommendations yet from, for example, CDC or Infectious Diseases Society of America on when and how that information can be applied, or when and how that information might be actionable at an individual level. Certainly, we still want everyone to use PPE and practice safe, social distancing and all. So, and I think last time we briefly talked about if and when we wanted to do some sort of population level testing, that would require significant support and leadership by an academic partner. So we haven't pursued that at this point. Right now, we're still very much focused on diagnostic testing, and hence the community-based testing site just launched today, with the soft opening. Given that we didn't have really as robust, even though we have had expanded testing capacity in DuPage County, it's still very much been a patchwork with the different, health systems and FQHCs and others providing testing, but still not a place like we have now as of today where anyone can, get tested. So I guess that's my understanding at this time, but I'd invite Karen, Chris, or anyone else to chime in.
Thank you.
And this is Sam. Rashmi, am I not correct that the antibody testing does not have the same accuracy rate as the diagnostic testing, which is another reason that we're not jumping into that type of testing with both feet at this time until we know that it's going to be a little more legitimate, if that's the right word.
Sure, there are a variety of tests that are out there, and some have more accuracy than others. But you're right, from a diagnostic perspective, and based on the case definition and the case classification criteria, it's only the PCR testing or the molecular assay where if that's positive, then that's considered criteria for someone to be lab confirmed. If someone is either antigen positive or antibody positive and having symptoms that meet the clinical criteria of fever and respiratory symptoms or the other constellation of symptoms, then they can be counted or classified as a probable case. But the diagnostic testing, as you mentioned, the PCR testing, even if they're without symptoms, they are counted just with lab confirmation as a case, as a confirmed case. And if I could just add, you're right that antibodies don't appear until a minimum of 1 to 3 weeks after infection. So it's the PCR testing that is a much closer to real-time indicator of actual disease activity and transmission.
And certainly Karen and the entire staff, Rashmi, have worked exceedingly hard to get our testing site up at the fairgrounds. And one of the byproducts of having it here, again, the first one we have in DuPage County, is not only is it going to give us an opportunity for people who think they might have the virus to get tested, but also a byproduct of that is we're going to have now more local people throughout the county being tested here. And our staff will at some point then be able to extrapolate those numbers and presumably be able to tell us where the hot spots are within the county. If we're seeing more people testing positive from a particular place, then we'll deal with it accordingly. So it's not only going to give our residents, our citizens, a place to get tested, but give us some more data. Regarding those signs, which are really nice looking, about 6 feet apart, and masks and being over at the county, has there been any thought to make those that signage available to businesses, the general public, public buildings?
Yes, we're actually going to be linking them on our website so other places can download them. as well, because I think you're absolutely right. I think people would appreciate that. Not only businesses, if they don't have to develop them themselves, but people will benefit from seeing some of consistent messaging across different locations. So yes.
I have one more question for Rashmi. Do we have any, and have we been able to generate any information from states like Wisconsin or Georgia, where they've been open for business a lot longer and significantly, greater than we have, and whether or not there are more deaths or positive rates in Wisconsin, let's take, since it's a neighboring state, since they've been essentially removed most, if not all, of the prohibitions from gathering together.
Right. I think they did see an increase. It's been a few days since I've looked at Wisconsin, but I know they did experience a pretty abrupt increase soon after their court ruling that essentially ended the stay-at-home order. And there was sort of this immediate, coming together of so many people in different settings, particularly indoor. So that may have contributed to some of the uptick, since it did follow that court ruling. I'll have to look at the graph, but because when you look at those cases over time, there's an arrow of right when that court ruling was, and then, or the end, when the stay-at-home order ended abruptly, and then the subsequent rise in cases. But I'm trying to think other than that. Again, Texas had a very brief stay-at-home order, and their cases have continued to rise. Georgia, at least as of last week, they hadn't seen a significant rise. And Florida is, I think, experiencing their highest number of cases per day currently. So, and I don't know, I think they had a pretty brief stay-at-home order, if at all. So I think there are some examples of cases of states where they didn't have quite the extended stay-at-home implementation that we've had. It's so hard to say, though. I don't know. There's so many variables. But yeah, because it could, who knows, we might see a second peak in this first wave. Certainly everyone's anticipating a second wave, to coincide with flu season. So the data, I think, ultimately are more informative than the projections, but nonetheless, it's a great question to see what we can learn from our, other states and what's worked and what hasn't worked in those settings.
I had lunch with somebody today who told me that they were unable to go on vacation in Florida right now because Florida is literally not letting people from the Chicagoland area into Florida because they're concerned about our toxicity, if you will, bringing into the state. It sounded a little outlandish, but he said that.
No, did they limit that to COVID-19, or was that just?
No, because he knew me. That's why he wouldn't let him into Florida.
No, just the toxicity of the state of Illinois.
Or that too. But it just, and they said that they would have to fill out all kinds of forms when they went down there. They might have to be quarantined for a while, and if you were from Southern Illinois, they were a little more lax, and they would possibly consider letting you come down as opposed to coming from Chicago. So I guess every state's doing it a different way, but I found that very interesting. Any other questions of Karen or Rashmi regarding our health update? A lot of information, a lot of great work. You guys have been truly remarkable.
If I could just jump in real quick, just to follow up on Sam's point, because I do think this is interesting dynamic to look at. We've just had all these demonstrations across the country and a lot of people coming into close contact. I don't think we've seen the dramatic spike in cases, even if there was some increase. At the beginning of this concern of COVID-19, it was like, we don't all lock ourselves in our houses. Everyone's going to be infected within a month. And I don't know if it's a slowdown in the transmission of the virus because of the summertime or something else. Even in those states who completely removed restrictions, maybe we've learned a little bit more about social distancing. I can tell you I have a place in Wisconsin, and I go up there and I social distance, but the residents there are not. they're going out to bars and they're sitting elbow to elbow, no masks, no nothing. So, and yet, while there may be some increases, not as dramatic as I think maybe we once anticipated. And I'm wondering, is there feedback in the epidemiology community where they're saying maybe it is slowing down due to the summertime, or maybe it is becoming less infectious as we thought it was, or anything like that?
I think it's a variety of factors. I think being outside definitely helps. I think if the protests were indoors, we'd probably be seeing already a more dramatic spike. So being outdoors helps. I think the more people that are masked, the better. I saw a headline today that the 2 stylists in Missouri, I think it was a Great Clips, who were working while ill and had exposed, I think, about 140 persons. That fortunately, so far, no one has come back ill or positive. And part of that is being attributed to not only the stylists wearing the masks, but the clients wearing masks. And so even though they were within 6 feet, probably for at least 15 minutes, even if, for a cut, that the source control mechanism of the masking plus just overall social distancing, I think the way the stations are being spaced out and everything is helping. So I do think that that being outdoors reduces risk, as well as masking and social distancing will hopefully help reduce risk. I will say California is still experiencing quite a rise, and their weather is at least relatively warm and mild, similar to us. So I haven't seen anything definitive about warmer temperatures, at least in Florida, as we know, is experiencing a rise in cases. But other than that, I don't know. I think we're still learning a lot. But again, I would ask Karen or Chris or anyone else to chime in.
Yeah, I don't think it's probably the warmer temperature, but I have read, and it was out of the University of Pennsylvania, I believe, that some researchers are beginning to study that the virus is mutating, but it's mutating to be less intense and have less symptoms. So there's some theories along that line as well.
Yes, thanks for sharing that with me, Karen. It was, I think it was UPMC, University of Pittsburgh Medical Center.
Okay, sure.
They have a biosecurity center and really have their finger on the pulse of disease activity. So yeah, that was a good recent article. Thanks.
And a guy in Italy came out with a rather dramatic and somewhat controversial statement about that as well. But he was an epidemiologist who was saying he thought the viral loads on patients he was seeing were dramatically lower than at the beginning of the situation.
Yeah, a lot left to learn.
Any other questions of Rashmi, Karen, or any other member of the staff? Okay, thank you very much for that update. Great information. And thank you for all you do. Move on to approval of the minutes. I'll entertain a motion to approve the minutes of May 14th, 2020.
So moved.
Second.
A motion by member Larson, seconded by Mr. Spadoni. Any additions, corrections, or deletions? There being none, all those in favor, please signify by saying aye.
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 Any opposed? And the minutes are approved. Moving on to the treasurer's report. Mike, I'll turn it over to you.
Mike, you there?
Mike, are you there? I don't see him.
There he is. Audio.
There you are.
I'm not sure he's aware it's his turn to speak.
He can hear us, but he can't. He doesn't have audio.
Okay. Maybe he can just hold up each page of the report against the screen.
Yeah.
Point.
Tell us what our
Point.
bank balance is by holding your fingers up. And hopefully we have more money. Well, why don't we do this? While Mike's trying to figure out and our staff's trying to figure out how to get them, maybe we can move on and go on to the other items at this time. And when Mike's ready, just let us know. If that's okay with the rest of you. We can come back to the treasurer's report. So we'll go to consent items, personnel transactions. I'll entertain a motion to approve the one personnel transaction on consent.
So moved.
Second.
Motion and a second. Any question, discussion on that item? There being none, all those in favor?
Aye.
The opposed? And the item is approved. Moving on to action items. If there's no objection, I'll entertain a motion to combine and approve items 8.1 A, B, C, D, E, F, G, and H. These were all grant acceptances.
So moved.
And second.
Motion by Mr. Larson, seconded by Dr. Olson. Any questions or comments by anyone, including staff, on those items? Okay. There's a motion, a second. Can we have a roll call, Penny, please?
Mr. Larson,
Aye.
Dr. Munir,
Yes.
Dr. Skelton,
Yes.
Mr. Spadoni,
Yes.
President Natori,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein.
Yes.
Mr. President, the motion passes.
Thank you. We'll move on to procurement. And again, if there's no objection, I'll entertain a motion to combine and approve items 8.2 A, B, C, D, E, F, G, and H.
So moved.
And second.
There's a motion and a second. Any question or comments by any member of the board or staff
I just
regarding
have,
procurement?
I have
Yes.
a question. With
Dr.
the dental supplies, I didn't realize that our dental services were still ongoing. Are we
Yes,
still-
we've closed many of the dental services, but I think this is our annual procurement. Pat, do you have?
Yes, it
anything
is.
to-
Yes, it is.
Mhm. Okay,
Okay, so you just have to keep things fresh even though it's not being used that much.
correct.
Right. Okay, thank you. That's all.
Any other questions or comments? Okay, there's been a motion and a second. Penny, would you call the roll on this, please?
Mr. Larson,
Aye.
Dr. Munir,
Yes.
Dr. Skelton, Dr. Skelton, Mr. Spadoni,
Yes.
Mr. Thurston, oops, sorry, President Natori,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein.
Yes.
Mr. President, the motion passes.
Thank you.
And Sam,
Mike?
yeah, Mike is back.
Is Mike
so,
back? Okay.
Yes.
Mike, treasurer's report, you're on.
Yes, I'm back. Okay, April 2020 Treasurer's Report. As of April 1st, the Health Department General Fund balance totaled $22,744,536.76. Receipts for the month totaled $2,145,273.30, and disbursements totaled $967,245.51, leaving a month-end total in the Health Department General Fund of $21,922,564.55. Combined balances in all four health department funds as of April 1st totaled $30,833,375.48. Combined receipts for the month totaled $2,168,814.19, and combined disbursements totaled $3,465,305.15, leaving the combined balances in all four health department funds at $29,536,884.52. Investment earnings recorded to the general ledger in the month of April for all four health department funds totaled $36,349.39. Including the April earnings, year-to-date investment earnings in all four funds have totaled $177,760.73. Any questions?
Okay, any questions of Mike on the treasurer's report? Okay, there being none, I'll entertain a motion to approve the treasurer's report.
So moved.
Motion by Dr. Wilson.
Second.
Second by Mr. Spadoni. There's no further questions. Roll call, please.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein,
Yes.
Mr. Larson,
Aye.
Dr. Munir,
Yes.
Dr. Skelton. I think he's on mute. Mr. Spadoni,
Yes.
Mr. President Natori.
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. And the treasurer's report is accepted. Moving on to unfinished business. Does anyone have any unfinished business to bring before the board? Anybody have any new business to bring before the board? Okay, I did want to point out, whether it's under unfinished or new business, that board appointments for 5 of the board members expire on June 30th. Those members are Dr. Stoughton, Dr. Wilson, and Charlie Thurston, as well as Bob Larson and myself. Term expire on June 30th with appointment presumably by the chairman. We do not have a meeting in July, so there's no great sense of urgency, even though the term is up on June 30th. If for whatever reason we don't get around to doing this until either August or September, those board members will continue to serve by month to month by designation. But I did want to point that out, particularly to the 3 of you, as well as Bob and I, and see what your wishes are for serving another term or not. Please contact Karen or I. Let us know what your interest level is so that we can deal with this presumably by the August meeting. And then Bob, you and I will have to talk to Cheryl and Dan and figure out what we need to do on the county end of it. Okay, there being no old business or new business, we will now, I'll entertain a motion to go into executive session. Mr. Larson.
Yes, Mr. Chairman, I will move under 5 ILCS 120/T2C5, the purchase or lease of real property for the use of the public body, including meetings held for the purpose of discussing whether a particular parcel should be acquired. But note in the agenda correctly reads that it's under 5 ILCS 120/T2C6. We've sought the advice of counsel, and as long as we've made clear the reason for our going into executive session, we should be great. So that's my motion, Mr. President.
Thank you. Is there a second to that motion?
Second.
Second by Dr. Wilson. Please call the roll.
Mr. Larson,
Aye.
Dr. Munir,
Yes.
Dr. Skelton,
Yes.
Mr. Spadoni,
but I don't really know what the benefit is. I don't know why we're going to do it.
I would say it's a waste to do the antibody testing between, this is Robert Spode. We tested all of our employees and the rate that has come back that you have the antibodies is very low. I think it was like 3
Yeah, that's pretty cool.
You
Yeah.
look completely different in this room, Bob.
Okay.
Thank
And
you.
Dr. Hussein, get
Dr. Hussein is-
straightened
yeah.
out there, buddy. Okay. All right. We are back. I'll entertain a motion for a delegation of authority to the executive director regarding the Central Receiving Center.
So
So
moved.
Or-
Motion
second
by
Mr.
Dr.
Dr.
Wilson,
Wilson.
a second by, who was that? Who
Me.
seconded it?
Me,
Me.
Larson.
All
Second.
right, Larson, second with Larson. Okay. Roll call, please. A couple more minutes.
Okay,
Any-
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein,
Yes.
Mr. Larson,
Aye.
Dr. Munir. Dr. Munir.
You're on mute.
Oh, I think you're okay.
Give us a thumbs up.
Thumbs
Dr.
up, she's all right.
Dr. Skelton. Dr. Skelton, did we lose him? He's still connecting for some reason.
He was with us.
His audio isn't connecting.
I'll say yes. I'm off mute now. I figured it out.
Okay. Yeah, he's still connecting, so we'll move on. Mr. Spadoni,
Yes.
President Natori,
Aye.
Dr. Weeks.
Aye.
Okay, Mr. President, the motion passes.
Okay, thank you. Our next meeting is August 13th, 2020. We have the month of July off. Hopefully we will enjoy the month of July, and I trust and hope that we will be together in person on August 13th. I would remind again, Dr. Skelton, Dr. Wilson, and Charlie, as well as Bob and I, to contact Karen or I regarding your intent on serving beyond June 30th. And there being no further business, I will entertain a motion to adjourn.
So moved.
Second.
The motion and a second. All those in favor?
Aye.
Aye.
Any opposed? We are adjourned. Thank you all very much. Stay well, stay healthy.
Thank you.
Everyone.